The man lived in this senior's care home.
He was a man in his 80s, and he had a number of underlying health conditions, unfortunately. So in that risk group for people who are more likely to have severe disease with this.
Families with loved ones at the center are understandably worried.
This is absolutely my biggest fear, is that someone would pass away from this virus, and that, that it would come to his care center. That's my biggest fear, because he is the least able to fight it off of anyone I know.
So far, her 88-year-old father with dementia isn't showing any symptoms, but he's got a compromised immune system and is considered high risk.
I just feel so helpless because we can't remove him from the facility or go there.
2 healthcare workers at the center have tested positive for the virus. So has another resident. Many more are being tested.
First, our condolences go out to the family, but I want to reassure Canadians that we have our top medical experts, our top scientists on this issue.
Officials are closely monitoring other care homes too. Healthcare workers often move around, working at multiple facilities.
There's obviously elements of concern for your own health and your own well-being, but also too, I think caregivers feel a great duty of obligation and service to the people that they look for.
The worry in BC is amplified by what's happening in neighboring Washington state. Of 22 people who have died there, 19 lived at this long-term care facility.
And the responsibility for all of us is significant to not go out when we're sick, to not work when we're sick, to not go to school when we're sick, but also to not visit care homes.
BC now has 32 cases, though the province's health minister says very few have required intensive care. Tina Lovegreen, CBC News, Vancouver.